live when you are. Appreciate it.
And you are live.
Oh, thanks, Anthony. Evening, everybody. I'm Dominic Johnson, and I'm Chair of Community Services Committee of the Common Council. I'd like to call our meeting to order here at 7:04 p.m. on this Wednesday, June 15th, 2022. And first of all, we shall do the roll call. I see here we have Tom. I see now we're streaming on YouTube. All right, so we've called the meeting to order at 7:04. And Tom Keegan is here. Hey, Tom. Greg Burnett, he is here. Hey, Greg. Barbara Smith. Hi, Barbara. Nicole Ayers. I see she's present, not on camera.
I'm here, not on camera, guys. I'm here though.
You got it. Nicole Ayers is present. Hey, Nicole. And last but not least, Heidi Alterman. Hi, Heidi. All right, we are here. We have a quorum. One member is not present, Diana Regulus, for the record. All right. So we are now ready to move on to public comment. And so is anybody, Anthony, anybody here for us to promote for public comment?
Is there anyone from the public who wishes to speak? Please raise your digital hand. And it looks like we have none right now.
We have none. All right. Okay, we have some attendees. No public comment. All right, for the record, no public comment here attending. But does anybody rather on the committee, including you, Chair Daniels, good evening. Do you have any correspondence from any constituents or residents from the past, what has it been, 2 months since we've met? 2 meetings?
That's right. It's been about 2 months. No, my office has not received any corresponding from the public.
Okay, excellent. Any council members present receive any correspondence regarding any agenda items tonight? Okay, I have not as well. So that concludes our public comment. So we will move on to approval of the minutes. Now we have 2 minutes to approve, given we have a special meeting that occurred on May 4th. And we have received those minutes thanks to Telesco. First I'll ask for a motion of approval. Anyone want to move the minutes? Oh, I see Tom Keegan's hand. I don't know if anybody else had their hand up. My apologies. So Tom Keegan, yes, you get the motion. All right. Any edits, corrections, changes that anybody has for these minutes? I'm scanning. I don't see any hands. I know, Nicole, if you can use either raise hand or you'll just let me know verbally, that's great. I do see a couple of misspellings of names for the record I'd like to change. And the first is the first name of Dewan Wiggins. This is in the minutes for April 20th, 2022. And it was obviously was under public comment on page 2, I believe. His first name, as I believe, is spelled D-A-J-U-A-N. Mr. Dewan Wiggins, that's his first name spelling. I also believe on the same page down at the bottom, Miss Sarah Johnson has an H at the end of her first name. All right, and that is for the April 20th. I think, can we move these minutes together? That's my assumption. We'll move them together. No, we have to move them separate. Thank you, Councilmember Burnett. So if I amend the motion on the table, Mr. Keegan is moving the minutes for the April 20th meeting. Is that, I don't think we have to vote on that amendment, do we? We're just clarifying. So April 20th is being moved right now as a clarification. Any other edits, corrections, suggestions to the April 20th minutes? All right, seeing, hearing none, we'll call for a vote to move. Oh, Ms. Alterman, was that oh, no, you're good. All right, so I will call for a vote to approve these minutes as amended. All in favor can raise their hand or say aye. And now I'm scrolling back. That is, Ms. Ayers, are you aye or are you abstaining or against? All right. Well, let me ask, any abstentions? Any noes? All right, so I assume, well, that's Councilmember Alterman, Councilmember Smith, Burnett, Keegan, and myself, Johnson, and Ms. Ayers. Yes, thank you, Councilmember Ayers. So unanimous approval of those minutes from April 20th as amended. All right, Next set of minutes, I'd like to ask for a motion to move the minutes from our special meeting on, I believe the date is May 4th, 2022. Do I have let me double check that. Scrolling up, yes. Do we have a motion for that to move those minutes?
I'll move that.
Thank you very much, Councilmember Smith. And so that has been moved. Any edits, corrections, changes? Seeing and hearing none. So then I believe we can ask for a vote on that. So all in favor of moving these minutes, approving these minutes, raise your hand or say aye. And scrolling through, I think Councilmember Altman, you were a yes or no? Okay, yes, I'm scrolling on, for some reason it's locking the last speaker on the main screen here for me. And Ms. Ayers, so that's unanimous. We have moved the minutes. It's unanimous for the special meeting. All right, that moves us along here in this agenda. And next on our agenda is, moving back to the agenda from the minutes, is to have a discussion. First, we will hear our updates from our health department. Next, we have guests from Mid-Fairfield Child Guidance Center, their presentation. And then, as you see, then we will conclude this discussion with updates from our chief, Lamont Daniels, who right now I will pass the floor off to so he can pass it off to his amazing staff. Thank you, Chief Daniels.
Thank you very much, Chair, and good evening, everyone. Good evening, committee members. So tonight, as Chair Johnson indicated, I'm really excited. We have a few presentations that we'd like to share with you, but as always, we want to, it's been a while since we did cancel last month. So Dan Diamore, our health director, as you know, and Brian Weeks, our epidemiologist, will share COVID updates, and then we'll entertain any questions that you may have after the presentation and discussion. Good evening, Health Director Diamore. Good to see you.
Thank you, Chief Daniels. Good evening, everybody. So Brian's going to begin the update with an update on data and where we are with trends, and then I'm going to give some updates on the vaccine front. Thank you.
All righty. Well, thank you, everybody. Brian Weeks here. So let me just start the presentation. Give me a second to make sure it comes up. All right, here we go. All right, so what you guys should be seeing on the screen is just a reminder that this data was pulled this afternoon as of June 15th, 2022, is provisional and subject to change. So what I always like to start off with is the current stats for obviously the country and a global level, and then obviously the CDC community level. So we'll start off with the left-hand side here. This is from the Johns Hopkins University Coronavirus Resource Center. Global confirmed COVID-19 cases are about 537 million. Global deaths about 6.3 million. US confirmed cases about 86 million, and US confirmed COVID-19 deaths about 1.01 million. And so obviously that is the toll throughout the pandemic that we've been experiencing through these now many years of it. And so in terms of the CDC community levels, this is an important metric and framework that's developed to really kind of monitor COVID activity, especially in terms of healthcare utilization in like hospitals. And, you know, I've mentioned this before, but just as a little bit of a re-education, you know, there's 3 levels. It's a 3-tiered system. It has low, green, medium, yellow, high, orange. And obviously you don't want to be in the medium or high. And very fortunately for Fairfield County, just speaking about that quickly, you'll see in the zoomed in version of the map in the right-hand side corner here, Fairfield County is in the green along with New London County. New London has typically been in the green throughout most of this process, but just bear in mind, only like a couple weeks ago, Norwalk, the Fairfield County was actually in the high or orange category. We were there for just 1 week, fortunately. But it just goes to show how rapidly things can change relative to the COVID situation. As well as there still are 6 other counties in the state of Connecticut that are still in the medium or yellow. So now speaking in terms of the country, in terms of the high category, we have about 9.74% of the country still in terms of counties that are in the high, 32.75% of counties in medium, and then 57.5% in low. And as you can see, and you may recall from the prior presentations, especially when we were seeing the uptick relative to BA.2.12.1, the subvariant of Omicron. The Northeast was getting hit quite hard. You know, remember upstate New York was all orange. Obviously Connecticut was, you know, mostly orange as well, along with Massachusetts, New Jersey. Fortunately now it's, it's a more yellow and green. You have some orange relative to New Jersey right now. So they're still getting hit a little bit hard. There's still obviously still yellow in certain parts of these states as well. But as you can see, the COVID activity has really expanded, with BA.2.12.1's territory expanding to really, especially Florida, a popular tourist destination, the mid-Atlantic region, parts of the Midwest, the Southwest, as well, especially even the West Coast. I mean, fortunately, California hasn't turned completely orange, but it has been jumping around. And don't forget, only a few weeks ago, it was actually mostly green. And so things do rapidly change. And then keeping in mind, also like Puerto Rico is also in the medium or yellow level. And also just speaking on a global level, a lot of the Caribbean still being impacted quite a bit. And so that's also a very popular tourist destination as we are in the middle of the summer or close to the summertime, right? We are 6 days away from the official start of summer. So this is, again, just a reminder what exactly entails the low category. So stay up to date with COVID vaccines, get tested if you have symptoms, wear a mask if you have symptoms, a positive test or exposure to someone with COVID-19, wear a mask on public transportation. So that's going to be really important relative to travel. And anybody could choose to wear a mask at any time, especially as a precaution if they are at risk of high or severe illness. So just wanted to mention that as well. But obviously this is kind of the categorizations, but we've talked about that as well in the past. So again, really the big thing to monitor is the variant / subvariant situation for the country. On the left-hand side here, again, as a reminder, the darker shades of purple is, BA1. Then we had BA2 enter the picture in the lighter shades of pink. Then we had BA.2.12.1 enter in the red-orange kind of color. And you can see how they all follow similar trends, like they slowly or gradually develop, and then, boy, they start really growing. And that's what we've been experiencing relative to BA.2.12.1, and it's really been the forerunner and very directly proportional to the COVID activity we see with all these counties and throughout the country and consequently the world. But as you can see here now, there's shades of green. These are for BA4 and BA5. So these are some new subvariants that have been circulating for a little while. It's not something new, but they are picking up speed, as you can see, especially for the recent 2 weeks. And so they are also suspected to be new drivers of another wave of COVID activity. So right now, in terms of the proportional breakdown for the week of June 5th to the 11th for, the country, you have BA.2.12.1 at about 64%, BA.2 at 14%, and continually decreasing, and then BA5 at 13.3% and BA4 at 8.3%. And so if you look at the regional map on the right-hand side, this is kind of telling an interesting story and kind of goes in line with what I was mentioning before. The Northeast got hit quite a bit and quite hard with BA.2.12.1. It spread from there to the rest of the country, but we still have the largest proportion in terms of new cases that are for that subvariant. Now, as you look at the rest of the country, what's kind of interesting, because these subvariants are competing for territory, right? They're infecting individuals that are susceptible. You can see how the West Coast and the South and the Southeast have the largest proportion of BA4 and BA5. And so what we should anticipate is that trend's probably going to jump to eventually the Northeast in terms of that increasing proportion of BA4 and BA5. They seem to have the characteristics that would succeed in outcompeting BA.2.12.1. So that's not great. And there's also been, indications that somebody can be reinfected as well. So there's also that issue, along with obviously the evasion of vaccines as well. That plays into its success in spreading. So it's something to keep a very close eye on. Again, it was first, detected in South Africa, but obviously has made its way globally and consequently this country as well. So with that, looking at kind of more immediate situation in terms of hospitalizations for the state of Connecticut, this is again from the State Health Department. So looking at for July 2021 to June 15th today. So the most recent report that came out from the state. As you can see, we have about 272 COVID-associated hospitalizations for the state, which is good. It's a downtrend from, again, the prior weeks where we peaked at 383. So it's good news to see that it's decreasing. It's still hovering back and forth, still seeing some minor impacts related to the Memorial Day weekend because it takes time for people that have been exposed to manifest the illness and consequently expose others and cause that chain of transmission. But for more or less, it's been more mild than it obviously could have been. So we're very grateful for that so far in terms of what the data is indicating, especially with the hospitalizations. But nonetheless, just to break it down, Fairfield County is about 22% of those new COVID hospitalizations, Hartford 39%, and then New Haven County about 26%. And so just kind of jumping to the next slide, just kind of breaking down where we're at in terms of case rates for the big 7 Connecticut cities by population. You can see Norwalk is at 22.5 per 100K with a percent positivity of about 12%. So the highest is actually Stamford at 26.7, 14% positivity. And the lowest is Danbury at 14 per 100,000 with 12.1% positivity. So you can see the range has narrowed in between the lowest and the highest in terms of the big 7 Connecticut cities. But obviously, we're performing somewhat similarly to Stamford, as well as, some of the other cities like New Haven and Waterbury aren't too far off from us as well, along with Hartford. So just something to keep an eye on. It's obviously the range has decreased, and fortunately, it's a downtrend as well. So if you again look at it for Norwalk over the weeks, we were at 36.8, 37.2 where we peaked, 33.4, 22.5. And we anticipate that with the new update from the State Health Department tomorrow, it should put us somewhere in the 10s, so maybe like 16 or 17, somewhere around there. And so that's also good news to just see that trend decreasing. So in terms of the total pandemic impact for the city of Norwalk, we're about at 23,300 total cases, 271 total deaths. In terms of age group proportions, again, this is not a bad thing to see in terms of the current activity. So again, this is data reflective of May 29th to June 11th. We do at least have the largest proportion, the usual suspects in terms of the 30 to 39-year-old age group. So that's usually where it always kind of formed a bell curve and peaked over there. But as you can see, the 50 to 59-year-old age group is at 18%, so not too far behind, which is, again, it's usual for the recent surges of Omicron, not necessarily usual for the entirety of the pandemic. So it is, again, emphasizing the fact that for this older age group that, the vaccine effectiveness has waned because, they have the primary series and then you have the booster shots. And so there's obviously room for more of these individuals to be, that are eligible to receive this booster shot vaccine. There's more opportunity for it because obviously consequently more of these individuals are presenting as cases. Because as you can remember, the vaccine not only helps with reducing hospitalization, it also helps reduce some transmission because, obviously somebody's not experiencing as strong illness and therefore they're not going to expose as many people. So there is that emphasis as well. But then in looking at the younger age groups too, you do have 10% for less than 10 years of age. So, there is still a dispersion, a wide age groups dispersion, but fortunately it's more centralized where it usually is or tends to do in its natural state. So in terms of vaccination, as we were talking about, so this is the most recent data up to June 8th. You can see how for all ages for initiated vaccination, so it means getting at least one dose of the vaccine, we're at 88.77%, fully vaccinated 79.73%, and then additional doses received 42.36%. So again, emphasizing my point about booster doses. So you see for 65 plus, and we'll focus on the additional doses received at the moment, that's implying at least one booster shot. You got 83.2%, which is good, right? It's great to see that. Keeping in mind that we got to the rough estimate. These are all census estimates, so they're not perfect, but essentially almost everybody 100% for fully vaccinated for 65 plus. But then, as you can see, with booster doses for 45 to 64, you only have almost about 58% in terms of uptake. 25 to 44, you only have about 37% uptake. 18 to 24, 30.22%. 12 to 17, 29.13%. So again, it follows that linear trend. The younger the age group, the less uptake of the booster doses. Now, keep in mind, there's a lot of things that play into this. Obviously, temporally is an important consideration. And also, just people, the emphasis in terms of booster shots, in terms of people getting that has been variable in comparison to fully vaccinated as well, whether it's the workplace that may require things of that nature. So that's also something else to factor in. And it's also have gotten a little bit confusing in terms of who's eligible as well, as obviously more guidance keeps coming out and things keep changing relative to those brackets, age brackets. But nonetheless, that is something really important to keep in mind. People are eligible for their booster doses. It's important to get these, as especially we kind of manage these various waves of these subvariants of Omicron, and as well as anything else that may come up. Staying up to date with that, the vaccination and maintaining that high level of immunity to reduce that severity of outcomes, as well as just the manifestation of infection is going to be really important. But again, also even for fully vaccinated 5 to 11-year-old age groups at 41.64%. So another thing, as an opportunity to the summertime, as schools are about to conclude this week, just kind of factor in our outreach efforts in our various capacities and with various partners and community organizations. So I just wanted to emphasize that point. So again, flu is still out there in the country. Also even with the Southern Hemisphere, which is currently, 'tis the season for them, their winter time. And so they're getting hit, pretty hard in comparison to us. And naturally that vice versa when we enter our winter time. But nonetheless, as you can see, the Northeast is doing better in terms of flu. So it's more or less at that higher level of minimal activity, if not low activity when you factor in New Jersey. You can see how, especially again, the Southeast with Florida, pretty high activity or very high activity in terms of influenza-like illness being reported. Then you also have like New Mexico and Nevada. It's also experiencing a decent amount of flu activity, and other portions with other states that are somewhere in the moderate category. So that is still going around, and something else to consider as well when we think of respiratory illnesses, even with this great weather that we're all kind of experiencing right now. So again, this all prompts the reminder about, what we should do and what we can do to obviously effectively mitigate the COVID-19 in our community with these various waves of, BA.2.12.1 that's still kind of running the show, but also BA4 and BA5 that's anticipated to also cause another wave, especially for the Northeast at some point, so it's something really important to kind of consider. In terms of testing, that's 4 days a week. And so that's again at Lockwood Matthews Mansion, lower parking lot, 295 West Ave, Norwalk. So it's 2 to 5 p.m. Monday, Tuesday, Thursday, 10 a.m. to 2 p.m. on Saturday. Then there's also at-home tests, making sure people are aware of, especially with the COVID.gov, they can order those tests free of charge. Also get free face masks from the government in regards to just, again, mitigating, say if we enter, especially to the medium level or especially the high level, making sure people are wearing masks in indoor settings, indoor public settings at that point in time. But nonetheless, just the at-home test. This is a reporting portal for us, that will make us aware at the local level, and our contact tracers will reach out and provide guidance as well. So that's also a really helpful addition and opportunity for the community to engage and get additional guidance, because the guidance is obviously not the most simple. It's pretty complicated in some ways. But nonetheless, vaccination, we have the link here just for everybody to kind of keep in mind that, vaccine clinics are still ongoing, and, obviously in terms of eligibility, as that, constantly changes, and be mindful of that, especially what we've been hearing in the news as of late, some changes in regards to that. So keep in mind, we had the biweekly report. The most recent one just came out last Friday. So the new one will be coming out the coming Friday next week. But that's also, again, accessible on the city webpage, Twitter and Facebook, and definitely check it out for the most up-to-date guidance and comprehensive guidance as well in terms of everything going on with vaccination testing and things of that nature. So just to mix it up a little bit, just a reminder that, we're also pretty much at that point in the summertime. And so we have to keep in mind vector-borne illnesses. So you have to remember ticks are out there. People can run the risk of exposure to ticks, especially their pets. Be mindful of that, taking the proper precautions to mitigate the, picking them up or their pets having them, checking their pets before coming back home after walking their pets. It's going to be really important to help mitigate tick-borne illness and that risk that's inherent with that. Now, also just keep in mind that, 'tis the season for mosquitoes. Right now on the left-hand side, what you're seeing is just the map of all the trapping stations that the Connecticut Agricultural Experimental Station has set up. We have two, fortunately, in Norwalk, one at Cranberry Park and one at Rowayton School. None of them, no mosquitoes detected thus far, but bear in mind that they've just been supplying this surveillance information. So as the weeks go on, we'll get more up-to-date info, but also in double checking surrounding towns like Darien, New Canaan, Weston, Westport, Wilton. Fortunately, they don't have any detected mosquitoes at the moment, but knock on wood, that holds. But being mindful of that, this doesn't necessarily imply that there's no mosquitoes around. It's just a lower activity. So be mindful of that, especially as people travel and go to other activities in neighboring towns and outside the state. Mosquito activity is going to vary, and so taking those proper precautions and using proper insect repellent and things of that nature as we engage in these various activities and enjoy the summertime and good weather. So that is just the update. Thank you, everybody.
Thank you, Brian. If I can just give some updates related to vaccines. So there's a lot of effort right now, a lot of activity around like evaluating and authorizing vaccination for the younger age group. So outside advisors to the FDA actually voted today to recommend that the agency authorizes Moderna and Pfizer vaccines for children as young as 6 months old. And so this is a process, right? FDA still has to formally evaluate it, and the CDC. So the CDC is going to be meeting actually like, I think it's Friday and Saturday to issue their own recommendations. So we could see formal authorization and recommendation for vaccination for, the 6 months up to, the 4-year-olds up to age 5. Like next week at some point or this weekend. So more to come on that, but I just want to let everyone know that process is moving forward. I know there's a lot of people that have been waiting for authorization for that younger age group. And so there's the Moderna vaccine and the Pfizer vaccine. And then Moderna also has a vaccine for those who are 6 years to 17 years old. And so that is also going through the process of getting recommendations and authorization. So that's moving forward. The outside panel also recommended that. So CDC is going to be evaluating and considering all of these different vaccinations, but I think they will be prioritizing the evaluation of those that are, under the age of 5. And I just want to let you know, so on the local level, our staff have been doing outreach to pediatrician offices to see, who's planning on vaccinating their patients. And if they aren't planning on vaccinating their patients, what's their plan in place for recommending the vaccine, and then also referring out to outside providers. And so we're evaluating community capacity, and we're going to be working with some of our other partners to make sure there's vaccination opportunities within the community. So, we work really closely with Community Health Centers, Inc. on their vaccination, as well as, Griffin Health that does the vaccinations for the state health department, Norwalk Community Health Center, all our key partners. And then just one other thing I wanted to highlight, if I'm sure many of you saw this in the news, but the CDC has rescinded their order to require a negative pre-departure COVID-19 test prior to a flight to the United States. So that just came out recently. So I just wanted to highlight that as well. And those are our updates.
Excellent. Thank you so much, Director Demore. I see we have a few questions. Councilmember Burnett.
Yes, thank you, Chair Johnson. To Brian and Deanna, I'm just curious now, now that summertime is coming and we're seeing outdoor concerts and events at the beaches and stuff, are we providing any communication or guidance at these events so that people don't, I'll say, put their guard down and think that everything is okay? And I'm just curious if there's any communication that's being done at these events to keep the public educated as it relates to not having us slip from all the good work that we've done and have an uptick in the spread of the virus.
So I'll just start by saying, we've worked really closely with all the other city departments throughout this process on the recommendations and the guidance. So I want to give a big shout out to Recreation and Parks for all that they've been doing throughout this pandemic for their guidance related to events and other things. So, we've worked really closely with them as different events have been held in terms of guidance. But, the general message is that we still have, like Brian was saying, it's really been dependent on this new guidance from the CDC related to the community levels, which has been very much focused on vaccination. That's been the big push and the big message, moving forward, and making sure, that we have the right hospital capacity, at any given moment. And Brian, I don't know if you want to add anything.
Yeah, I mean, just in regards to like the social media posts, the mayor's reports and, other mayor commentary, it's the mayor also presents to the common council. And as we also do these meetings and other meetings, obviously there's the city messaging service, especially as things uptick too. Getting, making sure people are aware of that level of urgency. But yeah, obviously we're doing a lot of different things in terms of trying to get those communications out there. And people being mindful, as you mentioned, in regards to making sure their guards up, because we got to be ready for BA4 and BA5 because it's likely going to cause an uptick. It's a matter of when. And so it may come in a couple of weeks. Obviously, it has conditions that could contribute to it. But fortunately, as you mentioned, with more outdoor events, it's actually better because there's better ventilation. So there's less opportunity for transmission. So people being aware of that. Ventilation is an important thing, especially in indoor public settings. But then wearing masks, if obviously somebody feels comfortable wanting to, as well as if they're high risk of that severe illness. But then also making sure that testing resources are readily available so we can detect that early and start seeing that uptick and get those communications out there as things kind of really keep increasing. But yeah, just keep in mind that, BA4 and BA5 is just the big kind of delta at the moment that can technically change things.
Fantastic question, Councilmember Burnett. Any other questions or comments about our presentation from the Health Department? I have one on behalf of everybody who almost is age required. I know is 50 for the second booster. Is that right, Director Demore? So for those of us who are like almost but not quite, do you have any insight as to when they may start moving that down?
So that's a great question too. So, another thing that they're looking at is the composition of the vaccine moving forward. And so some of the new research and development specific to Omicron variant. So I believe, they're meeting over the summer, to look at the different, so after they move through looking at the younger age groups, now they're going to be continuing to look at the composition of the vaccine moving forward. So no, nothing specific in terms of booster recommendations for those under, the second booster under the age of 50. But I think, we might see some additional recommendations after they look at, the composition of the vaccine moving forward.
Excellent. Thank you. That's great to know they're kind of meeting about, well, how we're going to move forward with boosters this summer. So thank you very much. That's good info. Any other questions, comments? All right. I'll just say that, since we haven't met, I don't know if I mentioned this, but the reason we canceled our May meeting, it was the exact night of the vigil for those in Buffalo that had been murdered. And so that was an important moment to be with the community. And so given that we haven't met with you all in 2 months, so it's interesting to see what the virus has done in those 2 months. It's also just to remind the public that particularly the Facebook page of the Health Department is such a great resource. So you can catch up on some of the great things you all have been doing too on the Facebook page. It's a really great resource. So thank you all for sharing that information with the public. It really is fantastic.
Thank you, Chair Johnson. Thanks for that plug.
Of course. No, it's good. Of course I follow you all, but it's really good stuff. So everyone take a look because it's really great to get that information in between meetings. So, and lastly, I think we're good. Any other questions for our epidemiologist, Brian Weeks, or Director Demore? Questions, comments? I don't see any. So I think that means we can put the meeting back in your hands, Chief Daniels, for the next part of our discussion. Thank you. Thank you all, Health Department.
Thank you, Deanna and Brian. Next on our agenda, they're known as Mid-Fairfield Child Guidance Center, but I'll let them share the name change. But way of background and context, those that served on this committee 2.5 years ago, which was my first assignment when during the end of 2019, the Governor Lamont supported unaccompanied minors in Connecticut. As a result of that, what most people don't know that in Lower Fairfield County, during that time, we received up to nearly 51,000 young people that entered our state. And Norwalk had its fair share of unaccompanied children that arrived. And two and a half years ago, under the former superintendent's leadership, they needed additional services to support this new rise in student population. And also, as my department was being formed, we also observed and learned of the many traumatic experiences that these children experience, either whether in their origin of country or their journey to the United States. And I personally have learned more and more. And so 2.5 years ago, the city of Norwalk stepped up to identify a resource to serve this particular population, specifically around the trauma and what they've experienced. And we are fortunate to have the expertise in our community, which is that of Mid-Fairfield. They are the only organization that provide this specific targeted service. So 2 years later, we continue to partner with them. The city has been very pleased with the services that they offer, again, specifically addressing and working with the specific population. And I also want to uplift that I believe they're going to share that oftentimes when you're looking at the sustainability, when you're looking at both private and public funding partnerships, I also want to articulate this is a good example of what a private and public partnership can do. And they'll talk about a little bit more. However, through this investment that the city makes every year to support, they have been able to expand and leverage this investment to expand their services that they'll talk about. And so, from a department perspective, this is exactly what we want to see. We all know that government can't do everything, the private sector can't do anything, but most certainly if we can come together and partner, we can do a lot of great things. And this is an example of the ability to use our funding opportunities and then the private sector opportunities to build program and to support our most vulnerable residents, in this case, our children, who are here, many not by choice, but they will share that. So without further, and then also, as you all know, this was supposed to be done last month. There is an action item. So we were prepared to do the presentation last month and then the action item. So you'll also, I am also requesting approval for the Common Council so as to continue the program. And I will make a note that we have the money in our budget. So I'm not asking for new money, just asking it to be released and doing contract for another year as they continue to provide these critical services. So I'll turn over to Gail, who is the executive director, and she can introduce the team, and then welcome, thank you all. And we're looking forward to hearing what's been going on since the last time we shared time together.
Thank you, Lamont. Thank you so much. As Lamont said, I'm Gail Melanson. I'm the executive director of our new name, Mid-Fairfield Community Care Center. And with us today, we have Marissa Mangone, who is our Director of Development. We have Clara Mesa, who is the Director of the LINK program that you'll be hearing about today. So Marissa, I'll let you say a few words before I jump into my piece.
Sure. Thanks so much, Gail. As Lamont mentioned, this has been an incredible partnership with the city and Norwalk Public Schools. I always say in an introduction, first and foremost, I am a Norwalk resident and a parent of kids in Norwalk Public Schools, and I couldn't be more honored and proud that this type of work is happening right here in a community that I love so much. As Gail mentioned, we have recently changed our name to Mid-Fairfield Community Care Center, and Barbara, as you can see, that logo really represents the magnitude and the diversity of the services that we offer. And you'll see there's a heart in the middle of that logo because that's what we lead with. Again, Gail will talk about our programs and services, and we have some exciting news about our expansion of this work. But again, I can't thank the council enough for this investment, and Lamont's leadership and partnership has just been remarkable. So I will share these slides, and as mentioned, you'll all be getting this deck after. Bear with me. And I have a daughter coming in. My apologies.
Okay, thank you, Marissa. So for those of you that don't know who we are as Mid-Fairfield, I'll just run through quickly. We've been around since 1956 in Norwalk. We are considered the safety net for families to make sure everybody has access to private mental health services and that they are not excluded due to finances or language or culture. So equitable access is really our emphasis. We have outpatient mental health services. We are located on East Avenue as our physical office, but we're also in schools, we're in the community, and we go into homes. We serve over 2,000 children, adolescents, and adults across all our programs each year. Most of our staff are trained in evidence-based treatment modalities. All of our practices are trauma informed, meaning that we look at individuals through a trauma lens to help understand how trauma has impacted individuals and potentially caused a lot of the challenges that the children and families are experiencing. All of our services are offered in English and Spanish, and we also offer services in Creole for our many clinical services and care coordination services. And for any additional language, we do use Language Link. And so basically any language that a family, their native language, we can access Language Link to support the family. We have an annual budget of 5.1 million, which is has been increasing and will probably continue to increase. And for those of you that don't know, in 2018, we affiliated with Clifford Beers, which is located in New Haven. And we are still our own 501c3. We do our own fundraising, but we share back office costs and back office services like compliance, HR, billing, and things like that. But we still do our own fundraising and all of those things. Marissa, did you want to add something to that?
I was just going to add, the partnership has really allowed Mid-Fairfield to focus on its core competency, which is delivering quality care and comprehensive care to the children and families that we work with. So by being able to shed those back office functions, as Gail mentioned, we've been able to significantly increase our budget and expand our programs and services. I think it's a model that is incredibly beneficial, and we're really excited about the partnership.
And in terms of our name, we were Mid-Fairfield Child Guidance Center. That kind of just reflected more of the traditional outpatient services, but over the years we've become so much more than that, and we are really in the community and providing wraparound care, care coordination. We're in the schools, we're in the community, so our new name has, we felt, really reflected better the work we're doing in the community. So in terms of the services, this is just a graph that shows age and by program who we're serving. So if you kind of look across, basically we're serving all the way from prenatal moms through adulthood between all of our programs. So some of our programs are serving just the younger ones, birth to 5, birth to 6. They're providing in-home services. As I mentioned, we're in the schools. We're providing victim assistance programs. We have enrichment programs. So we have a very comprehensive in terms of the age range we're providing in our services, as well as the level of support from, care coordination and assistance with concrete needs, all the way to individuals who have more intensive clinical needs and are coming for therapy 3 to 5 days a week for, 3 hours a day. So we offer the whole spectrum of services. And we also offer evidence-based services. So we have our dialectical behavioral therapy, trauma-informed care services that are all evidence-based, and we are collecting a lot of data to show the efficacy of our work. In terms of our bilingual services, so we are the primary provider for comprehensive behavioral health services for the Spanish-speaking population in the Norwalk community. So our services, we have a bilingual psychiatrist, we have bilingual therapists, we have bilingual care coordinators, we have bilingual consultants. So we have a breadth of services that can provide comprehensive services to the monolingual Spanish-speaking community, as well as other bilingual or monolingual individuals. We work with families to develop service plans that are culturally sensitive and really are responsive to the individual needs. So it's not a cookie cutter type of program where this is what you get. It's really based, it's driven by the family, and it is meant to address the individual needs of not only the identified client who may or may not be a child, but the entire family as a whole. Our staff are bilingual and bicultural, which is important because they really look at the unique cultural differences, including the race, ethnicity, national origin, religion, age, gender, all of that. We look at all of those factors when we're providing services to families. And as I mentioned, all of our services look through a trauma-informed lens, and as you will hear from Clara later, a lot of the families that are being served specifically with this LINK program have experienced extensive trauma, either in their journeys to come here or in their countries of origin. So it's very important that all our staff are trained and able to look at these families through a trauma lens. And our clinicians also practice cultural humility. So I will turn it to Clara.
Good evening, everyone. My name is Clara Mesa, and I am the Director of Community-Based Services at the Mid-Fairfield Community Care Center. Before I get started, I just want to remind those of you who were here last year may have noticed the name change in the program specifically. Last year, we were the ELL School-Based Initiative, but now we are the LINK program. Similar to our agency name change, it was motivated to better reflect the population that we're serving and the kind of ability for families to refer to what program they're a part of. ELL School-Based Initiative does not translate into Spanish, so that made it really hard for families to identify who was actually servicing them. And you'll hear me say LINK a lot. It's LINC, as that was in the beginning of the presentation, and it stands for Latinx Integrated Care. So I just kind of wanted to start off with that to, when you hear it, you know what I'm referring to. Before we could dive into the details of the program itself, we did want to share this slide to highlight the growing population of the multilingual learners in Norwalk, as Lamont mentioned at the very beginning. And we really wanted to track, particularly in the last about 15 years, how much the population has grown. The majority of these multilingual learners have arrived from Latin America, and the city of Norwalk really recognized the immense need. And together we met and we strategized how we could collaboratively support our most vulnerable population in partnership with Norwalk Public Schools so that we could provide these embedded school-based and in-home clinical services and care coordination services to the immigrant students and their families arriving in Norwalk and attending Norwalk Public Schools. In addition to the increase in numbers, the needs are also incredibly intensive and complex within this population. I'll go a little bit more into detail as we go through the presentation, but I did want to highlight a couple of layers that you'll see on this slide, because many of our multilingual learners often also have to work to support themselves and their families, which leaves them limited time for their academics. With that, we also have a lot of students who have interrupted educations and as a result are overaged for the grades that they are placed in. And that's an additional stress on top of them needing to master the English language. Next slide, please. So if it wasn't for the city's initial investment to support this very vulnerable population, we wouldn't be able to provide the additional support through our LINK program as we have to date. The students we're serving come to Norwalk, as Lamont mentioned, not by choice in the traditional sense, but by necessity. The students are often forced to leave their native countries due to life-threatening situations, including community violence, chronic physical abuse, exposure to domestic violence, sexual violence, and extreme political unrest. Many of these students and their families chose to come to Norwalk because they either had a family member, a friend, or an acquaintance living and thriving in our community. The graphs on the right hand of this slide give you a snapshot of the number of both the basic needs, such as access to food, housing, and medical insurance, and the traumatic exposures that these students and their families have. I want to point out that on average, students enrolled in our services report at least 5 different trauma exposures at intake. And that's despite the fact that they often underreport their trauma exposures, which I'll get a little bit more into in the next slide. Next slide, please. Perfect. The specialized population we serve in this LINK program often present with a lot of unique risk factors. We have trauma, acculturation, separation, and educational challenges as some of the most prevalent stressors that our team learns about as we begin working with families. In many cases, families are also initially reluctant to receive our services because of factors such as cultural stigma associated with receiving mental health services, and also the stigma about talking with outsiders about family functioning. So due to the vulnerability of this population and the pervasiveness of the traumatic exposures, many students and families often underreport their traumas, like I mentioned before. So here's an example. When we do our intakes, we have a trauma history screener, and our clients often answer no to the following question. Has your child ever been unexpectedly separated from someone he or she depends on for love or security for more than a few days? As we listen to the individual narratives of our students, we've come to learn that a very high percentage are in fact unexpectedly separated from a loved one because they're either coming to the US unaccompanied, they're being separated and detained during their migration, and or they're coming to live with a new caregiver that in many ways is a stranger to them. So it's by educating these families with regards to what trauma is and how it impacts the body that we can start to provide healing and hope. And it's by providing these social emotional supports to the students and their families that we can also educate them with regards to the expectations that we have in our school system here. We want caregivers to be active participants in their child's education, and by increasing the positive communication between the caregivers and the schools, families also feel more welcome and involved, and then that makes them want to be more participant and involved in their child's education, but also their school activities. We know that there are limited bilingual resources both in the school system and our community, so our fully bilingual team is able to provide support to a group of Norwalk residents that brings these unique set of challenges, and it also allows us to serve as a bridge so that we can link between the community and the school setting. The work that we do is critical, and we're so fortunate that the city has entrusted us to be able to provide this specialized population with the specialized treatment. So our service delivery model, it's been designed to deliver culturally sensitive interventions to this population. We currently have 2 clinicians and 2 care coordinators, all of whom are bicultural and Spanish speaking. Due to the complex needs of this population, length of clinical services are expected to average about 12 to 18 months, and care coordination services average between 6 and 12 months. Of course, this is all depending on the individual needs and the progress of both the client and the family unit. Within our model, we have the flexibility to provide wraparound services to meet the families where they are. And thanks to our partnership with Norwalk Public Schools, we've been able to enter the schools and offer services during the school day so that we can reduce barriers to care, such as lack of transportation, and also allows us to closely collaborate with the school personnel directly. We're able to offer home visits as well, which allows us to better engage the family system and provide that psychoeducation regarding the importance of prioritizing mental health. We also provide these services year-round, which is unique because not all school-based services are able to do so. And our partnership has also allowed us to work closely with Lamond and his department to respond collaboratively and effectively when needs arise in our community, which we are so appreciative of. So how do we help? One of our goals as a program is to provide families adequate support in order for them to achieve a greater sense of self-sufficiency. Our care coordinators and our clinicians work with families to help identify and connect them to community resources so that in turn they can be empowered to continue to access the supports independently. So for example, if a family is provided the contact information for a local resource, we encourage them to reach out independently. During the next session, the care coordinator would follow up on the outreach, and if the family has not yet made that first contact, the care coordinator may offer to call with the family so that the family can feel successful. Now, the care coordinator in many cases is able to call on behalf of the family, but that's not empowering them to navigate the resources independently, and that's really what we want to try to push. Because as we increase the number of connections each family has to the community, their sense of safety and belonging also increases. And many of our families express that they want to stay in Norwalk as long as their means allow. Another goal of our services is that we want to strengthen interpersonal relationships and self-worth, not just of the students, but also their family unit. So we provide that psychoeducation to both the caregivers and the clients through a trauma-informed lens to help them understand the presenting symptoms. We also offer to accompany and support families in meetings with other providers, which can include things like PPTs and DCF case reviews, which otherwise might be incredibly overwhelming and intimidating to caregivers who are often unfamiliar with these systems. We launched our initiative amidst the pandemic, which definitely came with its fair share of challenges, But as we all know, it also further accentuated the importance of addressing the mental and behavioral health needs of our most vulnerable population in our community, our youth. So from March 2020 through March of this year, we've received about 100 referrals and have been able to provide either care coordination and/or clinical services to 74 families. As you'll see on the top right, we have between a 70 and 100% rate of kept appointments, which is comparable to our outpatient clinic, and it's higher than our statewide benchmark. On the bottom right, you'll see that 75% of clients that completed treatment demonstrated at least a 5-point change in either overall functioning in their daily life and/or their problem behaviors throughout the course of treatment. On average, families have also demonstrated a decrease of 2.5 basic needs per household as a result of the care coordination support. Our program satisfaction data on the bottom left tells you that families enrolled in our services feel that their cultural and ethnic background are both respected and understood. The families also report feeling more equipped to handle crises after engaging in our services, as well as building a support network that extends beyond us as providers. And this again speaks to the goal of self-sufficiency that I highlighted before.
So thank you, Clara. It's amazing, amazing work that you and your team do. And just wanted to highlight some next steps and what we're looking towards is, as Lamont mentioned, this is really a unique program and is not possible without the city's investment. And we've been able to leverage the city's investment to secure additional funding from private philanthropy to add an additional team, which we are incredibly thrilled about. And the district has realized that, and the philanthropic community has realized that, and we're really excited. So we are in the process of recruiting a new team, clinician and care coordinator, which will allow us to expand our services. And I know that the philanthropic community is really looking to engage with both the city and the district to see how we can further, this work and hopefully add additional teams to be able to support this population. We continue to work collaboratively with Norwalk Public Schools to streamline the referral process, workflow and protocols. We meet monthly with the team at Norwalk Public Schools and meet regularly with Lamont as well. We are also looking to expand our outreach within the school to classroom teachers and other support staff, and not just the administrators within the school, because they are the frontline workers working with the students day to day. We're looking to continue to support NPS in the community in responding to the crises impacting bilingual and monolingual Spanish-speaking students, and continuing to partner and participate in community-wide efforts with other providers. So again, we could not be more grateful to the city and entrusting us with this incredibly important work.
And I just want to add that I think this work really launched a really strong partnership with Norwalk Public Schools, and we've been able to provide
Absolutely.
mindfulness in the elementary schools. We've been able to have embedded clinicians in the high schools to further support all high school students that weren't necessarily being able to access services. There's been many partnerships that have kind of grown as this kind of was the jumping off point, and I think it's been very successful.
And that's it.
So we will open it up to questions. Lamont, do you want to?
Thank you. So thank you so much again, Gail, Clara. There's Marissa. Everyone moves around. The thing was moving. I was like, where everybody go? So thank you so much. So I'll yield back the time to our chair to facilitate Q&A from our council members. Thank you so much.
Thanks, Chief Daniels, and thank you so much. I'll defer to my colleagues at first, but I just want to thank you for this presentation and for the care with which you presented this information to us. The the thing that came through to me was it's not just about your metrics, which were very impressive, but it's about the heart at the core of this program, and your work. So with that, I believe the speaking order is as hands were raised, I hope. So I will call on Councilmember Keegan to start us off. Thank you.
Thank you, Madam Chair. I have a question. Does Norwood Public Schools also provide mental health services to some of the students?
Are you talking to this specific population, Council Member Keegan?
And yeah, I'm just curious. I know that Mid Fairfield does, a great job with the people they work with, but are there more that the public schools themselves provide service for?
Yes, sir. I can speak to it. I know our chair, we participated, I think it was last month. Councilmember Keegan, I don't know if he was on that call. We did a thorough presentation with the public safety. I don't know the name. So yes. So to your question, yes, the school provides a variety of mental health services as well. So I think specifically for this part, this is a special, unique service, and so we work with the school on, what can the school do, but clearly the school can everything, and what is beyond the school regular scope. So that's how this unique partnership was developed and designed. But most certainly the school, and we partner with them, and we actually have a large meeting tomorrow to continue that partnership. And the chair, I can't remember the name of the meeting. I'm sorry, it's blanking me right now.
Right, Public Safety and General Government Committee.
Yes.
Yes, last month had that meeting. That's right.
And we had the
that's on
school
YouTube.
share all their services and what we're doing and how we're partnering with them to really let the community know how we all show up to support our students.
Thank you. That answers the question.
Thank you, sir.
And just what we hear from the school social workers and the guidance counselors is it exceeds their capacity many times, because they have so many students they have to provide within IEPs, that students who may not have an IEP but might be in need of mental health services, it becomes a matter of what are the resources and who can serve all of these students within the school day.
Thank you. Yeah, now I understand. Appreciate it.
Thanks, Councilmember Keegan. Councilmember Burnett.
Yes, thank you, Chair Johnson. I have two questions. One is somewhat related to Councilmember Keegan's question, but my first question is the Board of Ed recently opened a family center, which was promoted to be kind of a one-stop shop for families within the Norwalk Public Schools. Do you have a presence at that family center? That's kind of the first question. And if you don't, why not? And then the second question is related to, again, back to, I think Councilmember Keegan's question in terms of, is the Norwalk Public School Systems providing any type of services? Well, no, let me rephrase it. Can you clarify to me the referral process? I'm not quite clear what work does the Norwalk Public Schools, how many steps do they take before they say, we need to get your team involved? So, are there activities and services that are overlapping? Because I'm not clear on how students and families are referred to you so that you can engage your process. So is the public schools doing A, B, C, and D before they say, okay, we need to now pass this issue over to your team? So
how does a youngster get identified to you all, Gail, and what does that process look like?
first the family center question, and then the second.
Okay.
Yeah.
So, and they're kind of tied together. So I can kind of answer it all tied together. So we work closely with all of the resources that are in the public schools. So the family centers is one resource. Teen Talk is in the schools as well, from, the family centers as well. So there are multiple services within the district. And what the schools typically do is try to triage some of these families and individuals. So if an individual is struggling in one area, the social workers or the guidance counselors will try to identify either are they going to provide the service? Is it beyond the scope of what they can provide? Or sometimes they are providing the service and realizing it's beyond the scope. Something, and Clara, feel free to jump in if I'm, if you have something to add, but the advantage, as Clara said, that our program can provide that the Family Center can't necessarily or doesn't necessarily provide, and in addition to what the school can provide, is we can be in the homes. So if there is an individual or a family where a lot of the work seems to be family oriented, that might be a specific referral that would come to us based on that specific need. So that's one example of how a referral would come to us. But there might be another example where a student may not be engaging with a school social worker, or there's care coordination needs in addition to clinical needs. So then they would make a referral to our program where we can kind of provide the care coordination and the clinical support. A student who may not be showing up to school might be another example of a referral where we can really work with the family, go into the home, try to figure out how we can help that student to get into school. Claire, I don't know if there's anything else you want to add.
No, I think the only thing to add to your question about the Family Center, we do work very closely with them, and we have contact with some of the folks there as they're doing the registration process for some of the newcomers. If they're identifying that there might be additional needs, they reach out to us so that we can collaborate to see if they would be a good fit for our program. But that, whether we have a direct presence there at this point in time, I would say no.
And the way the referrals come in is they typically are coming directly from the school. So right now our teams are working with specific schools that were identified by the district as higher need schools, and which is why a third team is going to be so crucial, so we can provide additional support to additional schools. So usually the schools will be the one to triage, or it could come from the family center.
Great, thank you.
Excellent. I believe, unless you have a follow-up, Councilmember Burnett, on those? Okay, excellent. Thank you, Councilmember Burnett. Councilmember Smith.
Yes, thank you, Chair Johnson. First, I'd just like to thank you for the presentation and for the very fine and important work that you have been doing with our kids. I'm remembering back 2.5 years ago when you first presented to us, how very emotional and difficult that presentation was, to hear what these kids were going through. Perhaps it was particularly emotional for me because I was working as a teacher in Norwalk High School at the time when we received so many of the unaccompanied minors. They were not in my classroom because of being an English teacher, but as a teacher, you have other duties, and I had instructional strategy classes where some of those students were attending, and the trauma was so clear. And sometimes it was just a matter of just being there for the kids. There's a language barrier, making sure that if they needed to get to a counselor that they could. So just thank you so much. And I speaking from the bottom of my heart as a council member, that we were able to provide the funding you needed to get this program up and running, makes me feel really proud that we're able to do that. So and Gail, I think you answered the question that I had, which is I do recall at the time that you placed a full-time clinician in Norwalk High School. And so I believe you said earlier that you do have clinicians embedded in the school. So they are there full-time to work with kids right there throughout the day?
So we have 2 clinicians that are embedded in the high schools right now. Those are not for this specific population, but there are clinicians that also work in the high schools, as in addition to some of the other schools that serve each of the high schools. So they are assigned. So any referrals that come in. And the other point I forgot to make with the previous question was, in terms of the capacity, there are resources in the school, but typically there may be one social worker who speaks Spanish to serve all of the schools. So this is an added resource in terms of the Spanish speaking population for the care coordinators and the clinicians.
Yeah, and I imagine, just, through, you got the program up and running, you're there for the kids, you're providing the support, and then COVID, must have made it so challenging, to service those students.
It did. And I think it was great timing, however, because many of these students did not have access to technology, and really no one was in contact with these families. So thank goodness for our team, who was able to reach out, connect with the families, let them know that there is an online platform, and through the collaboration with the city and funding that was available, we were able to give people access to technology so these students could engage in remote learning.
So was there some collaboration there with the Family Navigators program? Just curiously, Lavonne?
Oh, absolutely.
Yes.
Absolutely.
Yep.
Okay, a lot. Yes. Okay. All right. Thank you so much.
Thank you for
Thank
your
you.
kind words and your support. We appreciate that.
Councilmember Smith, that was one of my questions coming up. And so to see how all these programs that, under your leadership as chair during this time, I remember that. And to see how these programs come together in collaboration is really, really fantastic. Councilmember Alterman.
Hi, thank you, Chair Johnson. I just wanted to say, so I first met Clara like when I was helping families in need at Cranberry, and she was amazing. And I just assumed she was like a full-time staff member at the school. And somebody had, and I was emailing her a lot, somebody had to explain to me, what she was doing there. And I thought, oh my God, I just was so impressed with how hard she worked and how much she cared. And then I met other people and everybody cared just as much. And it really, it really was very, very impressive. But also just how much they do actually coordinate with other organizations is really important. So I just wanted to give a shout out. Y'all are great.
Thank you.
Thank you so much.
Thanks, Councilmember Alterman. Any other comments, questions, clarifications from council members for Mid-Fairfield? Not seeing any hands. Then I'll take the opportunity to ask a few. Again, thank you all so much for this presentation. And I do remember that very emotional meeting where we had this presentation from you, and it was right after the policies were set in motion that also had these unaccompanied minors coming to our community. So my questions are back to, I think, some of a few slides, but I can recall that the metrics you showed, and I'm very interested because you exceeded your goals, and those goals, metrics wise, were very, these were achievable goals, but stretch, it seems to me. Even so, you've even surpassed that. So that is that fair to say? I mean, these seem to be. That's my impression of it. But I'd love to hear your thoughts on that. And then second of all, related to the metrics, I see your case management metric is at 100, which is wonderful. So that's retention. And then if that's the case, the other metrics around 70, what do you think would be some deltas for you there, even though I think that based on, tell me if you think those are meeting your mark, and if so, what that means. Hopefully my question is straightforward, maybe not, we'll see.
Gail, can we let Clara, not to throw Clara right into it, but I think Clara has such a unique perspective on how she's able to engage, her team is able to engage families, and then Gail, we can chime in after that, but I think Clara can provide some insight into how those metrics, why they are so impressive.
Absolutely, and thank you for the question. I think first and foremost, our team being fully bilingual and bicultural allows for the engagement, which can be very difficult with this population. It allows for the engagement to have a reduction in a barrier, because we are also very persistent in reaching out to the families. And I think, as Gail mentioned earlier, our partnership with the Norwalk Public Schools has allowed us to build relationships at the school level. And typically it's the schools who have the initial relationship with the family. So when they're referring to us, they're able to not just say, I'm referring you to this program. They're also able to say, someone named Clara is going to call you. Here is her phone number, because I am always the first point of contact to the families. And took some kind of working out the kinks, but we have learned that having the families have a direct name, contact, and a sense of who we are really diminishes some of that stigma and some of that fear with regards to who is that's calling me, because it's an unknown number. Do I answer? Do I not answer? And really having that relationships with the schools has allowed that intake process to go a lot smoother over time. And I think with our metrics, because our families build that relationship with us and they get that sense of we are there not just for their child, but the family as a whole. And we can be present in their home. We can be present at the school. We can be present over the phone. We have that flexibility that for a lot of the families who have very demanding work schedules, we're able to use their lunch break creatively to have that contact with them and kind of mold our schedules to meet their needs. I think a lot of the mental health field, it's meeting families where they're at. But for us, it's starting families where they're at. It's not meeting them. It's you tell us, you drive the bus, you tell us where we need to meet you so that we can join you in the process. And I think that's really helped to drive some of the data that we're able to present to you tonight.
Excellent. Thank you so much for that, Clara. And I think you're right. And I see in the chat, Councilman Alterman, do you want to, just for the record, state what you mentioned?
So sorry, I just took a bite of food.
Oh, okay.
No, all I wanted to point out was there were the family navigators, I think, had been trying to work with a lot of families and were hitting a lot of resistance at first and didn't understand why people wouldn't accept their phone calls or return them. After working with Clara, and Mary Oster was one too, they realized they need a phone number that's coming in, they need a person's name, and they need like a general time of day when they would get the phone calls. Once that was sort of confirmed, you know, they hit the road running or whatever, and they were really able to get services. And it seemed like such a small thing, but it was really, really important that they took the time to make that connection.
Thank you for that clarification on that. I appreciate it too. And I got you while you were having a bite, so I said, we're good. Thank you. And to me, what that sounds like, and the reason I asked this question is because, you know, those metrics are really important to demonstrate, you know, success, and is your program doing what you hoped it would do? But it seems to me that this exceeding goals then is because of this trust building, is what it sounds like to me. And the personal touch and the accessibility of the program seems unique in that way to me, based on what you're saying. So I think, you know, for those metrics, I guess for what I'm saying, are there any targets you'd like to look forward to hitting that you think this further investment will help you do? Because I know that's a lot of what you want to do, is expand the program based on the success so far. Any insight on that, about kind of goals you might have relative to the new expansion?
I think to your point, word of mouth is so important in our community as a whole, but particularly in the subset of population. And I think as we've existed for about 2 years, we've seen the power of word of mouth help the engagement. I think not necessarily a metric that is easy to quantitatively measure, but the adjustment period and the joining period of the clinical and care coordination services takes a very long time because of the hesitancy and the resistance. So my hope is that as we continue to increase our presence in the community, and now that we have a name that can be said both in English and in Spanish, it'll help families be able to say, oh, have you heard of Link? And we've actually had a couple of families refer other families that attend one of the schools. And that to me is very powerful, because we all know it's different if you hear it in a brochure, it's different if you see it on a website versus hearing it from someone who you trust. And so I think it's not necessarily a metric, but it is something that I'm hopeful to continue to put at the priority and be able to expand upon.
That's fantastic. And I don't mean to be overly emphasizing quantitative metrics. I know there's qualitative that are very important as well. So I appreciate that data point too. Yes, Councilmember Burnett.
Yes, thank you, Chair Johnson. I guess my question is around the future. You know, we're 2 years in to this program, and we're starting to hear the word expansion and enhancements of the program. And when we do that, that comes with more financial commitment. And, you know, and the problem's not going away. It's increasing each and every year. So when will we, or maybe you have, when will we take a step back and say, what will this look like 4 years from now? Because, you know, we can't fix it by just constantly saying, expand, expand, spend more, spend more. We have to look at this strategically to say, what do we have to do differently with what we have to address this growing problem? And when I say we, I'm saying Board of Education, City of Norwalk, all stakeholders. Because my opinion, we just can't keep saying we're going to expand to address the question. We have to strategically make some changes that can have an impact within the allotted financials that we have to put towards this program. So is that on the table for discussion to say, what will this look like 4 years from now, 6 years from now? You know, students are going to keep coming into the district. They're going to have issues. How do we address this without simply saying we need to expand the program?
Councilman, I would like to at least speak to it a little bit. And with respect to your question, I think it's bigger to say, you know, what can we do? I think it's bigger than that, specifically around, and I think it comes from a fundamental belief that as a government, as a municipality, do we have an obligation to serve all residents that live in our city? And because this is so complex, you know, our state has welcomed immigrants. We are a welcoming community. We are a welcoming city. And that if children and families or individuals come to our city and that require this specific service, I think we do have an obligation to support. As Councilman Keegan said, and you know, there's so much to discuss. You know, there's a strong partnership both from Norwalk Public Schools, from the city side, and specifically with Mid-Fairfield. So to say the expansion is needed in a sense that the city has made an investment, as you heard through this conversation, it was the city's investment to get underfunders to say how we can help. And as you also heard, it was because of the city's investment, funders are saying, we would like to do more. I want to specifically say in this particular meeting, I'm not asking for additional funding. I'm asking for the same funding from a city perspective, but that's my role and responsibility. However, we do know, as we just read, as the census come out, and this is probably a bigger issue, so I don't want to belabor it, but you know, the demographics are changing. So I think as a city, we all are grappling with how will we show up and serve our most vulnerable residents? And I think that's an ongoing question, to your point, from a department perspective, from a common council perspective, from a nonprofit perspective, from a state perspective. But what I can say is that, and when Chair was speaking, the metrics, those are our metrics as well. You know, we work tirelessly with our community partners that if you are receiving city dollars, we work with you, we partner with you. If we're not pleased with your metrics, we have those conversations. And we may do some course correction, some course action. And, you know, we haven't had that situation under my leadership, but I can assure you that if that comes to where partners that receive taxpayers' dollars, we hold them accountable. And if they can't provide the service to the to the quality that we need, that's a different conversation. But I'm very pleased, and we have continues to be impressed. In fact, Mid-Fairfield has been featured statewide as a model because the city of Norwalk should take pride that we made this initial investment and funders are coming to the table. And they actually did a presentation to speak on this issue. So I think to your point, you're right. You know, what do we do? But I think it's a little bit more complicated for us to answer on this level, because if residents are moving into our community, we have an obligation to figure out how to serve, of course, most cost effectively, but also identify, as you heard, those evidence-based programs that we know they work. They've been proven. Data and science says that these interventions work, and we will continue to look at that, but we'll also continue to seek other funding other funding opportunities to support. And very pleased that Mid-Fairfield did not come back to this to say we need to expand because the need is there. We thank you for that investment, and because of this investment, we are able to expand because we're not addressing all the young people that are there. We need support, and for those that participated on the mental health call, it was very clear that our children, our students have suffered because of COVID, and we are unable to meet the need, which is why, you know, my department and the providers are meeting tomorrow, and we will continue to meet to help strategize what can we do, how can we do it, and then there may require resources to meet the need. And so I would love to continue to have this conversation, but I think that, you know, from where we are today, we're doing what we can with the resources we have, and we're very pleased for the philanthropist organizations to acknowledge the great work that our city has done and say we want to be a part of it to help serve many children in the Norwalk school system, specifically our unaccompanied children.
Yeah, thank you for that response. The focus of my question is essentially what you said, that I just want us to remain strategic and always think 2-3 years out, and not get caught up in, well, this is what we have to do today, but at some point take a pause and say, what will we look like 2-3 years from now? And what are the needs? And what might we have to do differently to address the situation 2, 3, 4 years from now? So that was the essence of my question, just to keep us ahead of the curve. Thank you.
We have some really great partners to ensure we're doing that collectively. Thank you, sir.
And the only thing I would add is just, you know, with mental health, the earlier you can intervene and the earlier you can provide support and services, the better it is for the community as a whole, the individual and the family. So as we're providing these services, not just at the high schools, at the elementary school level, to hopefully support the family early on.
Thank you all. Council Member Alterman.
Thank you. I guess I will echo what Gail said. I believe I would invest more in these types of services because I think they reduce the need for police interventions, for emergency service interventions, you know, for children that maybe didn't have the resources to get set up with state insurance to be able to have medical appointments, and then they develop a chronic lifelong disease. I always believe in like pushing social services more than I think people are. So I'm actually thrilled with what the city did before and how well they're responding to the task that was given. And I think people are looking forward too. So I understand all the points, but I think they're doing great.
Thank you, Councilmember Altman. Any other comments, questions from our committee members? Just doing one more look on the Zoom boxes. Okay, well, it's on a final note, it's just very wonderful to hear that because of our initial investment in that 2.5 year ago meeting, you know, that the philanthropy community has seen the investment and the return on that investment in our people, and that they want to be a part of this too. And that I imagine that will be hopefully part of the future, is expanding those relationships. And I'm seeing nodding, that's great. And final note, just that this is one of the ways in which, you know, there's so much to be proud of here in our city, and that we are leading on this, and that we are looked at as not just a model, but a beacon for how to help our people who are most vulnerable is a real point of pride, I think, and I'm grateful to have this conversation all together this evening, a very rich conversation. So thank you all so much for the presentation. And I believe that we will have the action item at the end of our meeting, if I'm not mistaken, Mr. Daniels, or is it more appropriate perhaps to have it right now? What would you?
That would be
think?
my understanding. Once we do all the discussion, do that last, but
Very good.
I'll yield to you.
Very good. I think that's as written is as we should or can do. I don't see no reason to change that. I just wanted to run that by you. So please, thank you, Mid-Fairfield. We will return to the action item after our next report, which is from our chief.
Thank you so
Lamont
much.
Thank you, Gail,
Thank you.
Marissa. You do not have to stay on. If you want to, you're welcome, but you certainly don't have to stay on. We do have some other discussion items that we are. I guess that's me. So thank you again and good
Thank
evening.
you. Thanks for your support.
Thank you. So there's a few things that we would like to always lift up before I get to the agenda items. I just want to call out that I think it was mentioned. We just want to encourage all Norwalkers who may be viewing or view this later. We worked from the Community Services Department perspective. We work to promote and put up on all the city social media platforms, a variety of key citywide resources that all can benefit from. So I just want to remind residents that if you have not registered on the city's website, www.norwalkct, please do so to get alerts. So every time something's posted, you would get an email, because we do use many of those social media platforms to share. In light of that, and Council Chair, I did receive your email yesterday. Lieutenant Governor Bisowitz was here to promote the 2022 child tax rebate credit. And we were also very fortunate that last Friday, we actually had Deputy Commissioner Biello to speak to the larger community provider network for this committee. Every other Friday, our department hosts the citywide community provider collaborative. I think every time I say it, I call it something different. I got to get a name. I'll think of something to call it. And we continue to have over 60, 70, up to 80 of our nonprofit partners on that call. And that is the way that we get information out to our nonprofit community. So as they are serving our residents and the many facets that they do, they also have additional information that they can share. So for the purpose of tonight, just want to remind our residents that Connecticut, this is not the federal program. So as it was discussed on our call, this is not a loan, and this is not, this is money due to you. You are not asked to claim it on your tax return and be considered income. This is something that our state is doing. So I would just encourage our residents, and I just want to give the website, because I'm not going to go over the entire presentation, and it should be like right here in front of me because I have his slide deck. Here it is. I just want to encourage our residents to visit the website, and the website's not even on here. Oh, bummer. I'm sorry, please forgive me. Oh, to go on the website, which is portal.ct.gov, or call the telephone number 860-297-5999, and they also have all languages. So just wanted to promote that. I did catch your text at the latter part of the day, Chair Johnson. So thank you for that. I also want to promote, to know me, I'm always going to say I want to make sure we cover our seniors, and to our seniors are watching, this will also be promoted on our social media platform, the Norwalk Senior Center. Thank you, Anna Vivian. The Norwalk Senior Center will be promoting a workshop called Must Have Documents. The time may come when you are unable to express your wishes concerning your medical treatment or financial affairs, and there are certain documents that you must have in place for those that desire certain things to take place. So this will be a training at the Norwalk Senior Center, located at 11 Allen Road in Norwalk. To sign up, Norwalkers, that number is 203-847-3115 to make sure all things are in order. I got a lot of stuff on my table. So through you, Chair, I want to share an update We made a commitment both to this council and to those that have spoken in various public comments for the Equity and Justice Initiative. So I want to inform everyone that on May 11th, we promoted the job description, the position for the Equity and the Equity and Inclusion Officer. That position has just closed, so we are now working. So it's been open for a month and has just recently closed last week. And so we'll be working with our new HR manager. So I'm asking again, I know people say, well, you gotta be patient with me, that our new chief of HR has joined us. So we've met and we've talked, and we look forward to going through what our normal process would be to do our panel. And then the top 3 candidates will be then submitted to Mayor Rilling, and then Mayor Rilling will then select the best candidate. And just want to remind this council and those that are watching, this is a normal process. We're following our normal regular protocol and procedures and when we're hiring, and we look forward to doing that. And we're really excited that we are moving. We're working with our HR department to identify those that have qualified will be that first round, and then we will select those 2 for interview. So more to come on that, but we're continually to move in the right direction to hire the city's first Equity and Inclusion Officer. And then lastly, just a short update that, again, thanks to Common Council for the approval of the first round, if you will, of the American Rescue Plan Act Community Recovery Fund. So we are in the process of issuing contracts to all of the awardees, and periodically, as I talk with the chair, similar to what you all just heard, the organizations will be required to present metrics. Most of them are federally determined, so they're not our metrics, but I think the federal metrics are pretty good to share how organizations are using the funding. I also just want to elevate again that we awarded quite a few organizations with mental health, because that was one of Mayor Rowland's priorities. And so I definitely would like to keep the mental health issue before us, because that continues to be a need. I can tell you that on average, in a course of 5 days, probably my calendar, about 2, maybe 3 or 4 of those days, I'm in mental health discussions around identifying how we continue to advocate for resources from the state, from the federal, from all levels to expand or provide the need, because definitely all providers will tell you that the demand is very high, and they're doing their very best to meet the demand because the demand is high. And then we also have to remember those that are on the front lines, the one that provide those services. And sometimes they need time for themselves, and that's the self-care piece. So it impacts the entire system of mental health. But I want to thank publicly all the providers that provide mental health services in our community. They have risen to the occasion, and they continue to do the best with what they have to serve our children, our teens, our adults, our seniors in this time. Many residents have been impacted, and our nonprofits are on the front lines supporting them and engaging them to get them to a place of well-being. So that includes my updates. I'll definitely, Chair, entertain any questions from the council committee.
Thank you, Chief. Questions, comments for Chief Daniels on his portion of our discussion? One more go of, I think I just saw a hand. Yes, Councilmember Burnett.
Yeah, thank you, Chair Johnson. Just a quick question. As it relates to the new chief for the inclusion and equity, did we get a healthy slate of responses as it related to the job posting?
I guess I would say, how are you defining healthy?
More than one?
Absolutely. More than 10.
All right, good. Yeah.
More than 10. And we'll be meeting to review them. And then, again, with consultation from their HR director, new HR director, we'll be looking forward to identify those for interview and continue to move forward on the work that we've laid out and committed to do, sir.
Good. Thank you.
Thank you.
Excellent. Any other questions, comments? I can say from my piece, just for mentioning it here in the meeting, because I know it's important, we have equity and justice initiative on our, our agenda for the community, that myself as chair of this committee with the chair of ordinance, Lisa Shanahan, have been talking about ways to move forward the ordinance piece for the commission itself, the Equity and Justice Commission. So I just wanted to mention that tonight in consultation with Corporation Counsel, obviously, because we're talking about an ordinance. So just so that is out for everybody who may be watching. And I also see Anna Vivian put in the chat that child tax rebate, it's portal.ct.gov/DRS. And that was, I know, just thank you, Chief, and the Lieutenant Governor herself yesterday said, you may be eligible and you don't know it, so take a look.
Very
so,
true.
and it is open until the end of July. So that is something I know, Anna Vivian, we were there yesterday, and I know we mentioned our Family Navigator program there as a way people can also maybe get some access to this program. Again, connecting those dots. And there it is again for those, maybe not on YouTube, but for those right now on the Zoom, you'll see that. Thank you all so much. Excellent. Any other comments, questions for our chief here, Chief Daniels? I don't see any. All right. Well, I will move us forward to our action item tonight then. And I can enter that in. I will read it and then ask for someone to move this motion. So moving on to number 5 action items, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Mid-Fairfield Child Guidance Center Incorporated for continued in-home mental health and family support services for public school children under the Community Services Department for the period July 1, 2022 to June 30, 2023 in the amount of $399,996, account number noted. May I have a motion to, or may I have someone move that item? That is Councilmember Smith. I saw your hand first. Thank you for moving the item. Discussion, questions, comments about the item from the committee? I know we've had a robust conversation, but questions, comments? Not surprising given our robust conversation. So perhaps then we can ask for and call for a vote then. All right, so seeing no objections, or I do see a hand. Okay. Nicole, Councilmember Ayers, is that a question or comment about the program? Or are you ready to vote?
Oh, I was voting. I apologize.
Oh, no, we're good.
I was eager to vote. Sorry.
Yes. All right, then let's go. Then we will vote. So all in favor of this this action item, this motion, I see 1, 2, 3. Councilmember Ayers' hand is up. Let me just scroll really quickly. Thank you, Councilmember Keegan, for keeping that hand up. I see you. All right, that is unanimous on this item. It has passed unanimously. Thank you all so much. And I see Mid-Fairfield has dropped on the call, but I know they'll get the news.
I will alert them.
Very good. I bet so. I bet so. Before I call for one more motion, I just want to say I have a personal action item, which is to thank one of our council members tonight, Councilmember Keegan. I almost don't even want to say this, but this is your last community services committee meeting.
Oh, wow.
I'm just, it's hard to say. So I'm just going to say that. And I just want to give space and opportunity to give you not only a round of applause, but our thank you for being an amazing colleague. A person of great heart and insight. I don't know if any of my colleagues would like to share, but I see hands. Yes, Councilmember Ayers and then Councilmember Smith.
Thank you, Chair Johnson. To Tom Keegan, the one and only, the great Tom Keegan, hats off to you, young gentleman, for just the stellar work and the way in which you have maneuver and condone yourself around us. As being someone new to the council, you have always been a person that I could talk to and bounce ideas off. You have called me and we've had great and robust conversations. And for that, I will always be grateful for you. As this is the community service committee, you are a true light in this community. You are a true person of community service. Many people don't know the many things that you do and how you do it, because you do it without recognition. You have a servant's heart. And for that, I say, Tom Keegan, job well done. You deserve this
Thank you.
retirement. You deserve this rest. And I am just so happy to be able to sit next to you in the chambers for this little time. So thank you so very much.
Thank you, Nikki.
And Councilman, thank you, Nikki. Councilmember Smith.
I'm just so sad you're leaving, Tom.
Yeah.
You know,
Thank
you've
you,
just
Barbara.
been such a valuable member of this council, of this committee, of every, you know, you come to every committee meeting. You have been so dedicated. You know, we talk all the time. You know, we're friends. We're friends, and I'm going to miss the friendship. I'm going to miss the you know, professional collaboration. It's a huge loss to the council and a loss to the city that you're leaving. But I want to wish you all the best. And I know you're going to have a great retirement in Florida. You'll have Elizabeth there. You're just absolutely darling daughter. What an incredible young woman she is. And I'm just, you know, I just wish you all the best.
Well, thank you, Barbara. I appreciate that. I can promise all of you this, that, you know, Florida may seem a long way away, but I'll be watching you and I will be rooting for you from where I am. Thank you.
And we also get to do this again at the last council meeting. So
Yeah.
So, you know.
There, this is just the first one.
Thanks so much, everybody. It's been a pleasure serving the city with you. You guys don't know how much it means to me that, you know, we all got along so well, and we all wanted the same thing, which is we wanted to do good things for our community. And I value all of you as friends and colleagues. You don't know how much you've helped me to grow in the last couple of years. And I thank you as much as you're thanking me, I thank you even more. And Chief Daniels, keep up the good work.
Oh, thanks, Councilmember Keegan. On that note, I'm
Motion to
ready to
adjourn.
go. We're ready to go. Then we have a motion. Who would you like to give the motion?
Motion to adjourn. All in favor?
All right. Thank you, Councilmember Keegan. All in favor? That's unanimous. All right. Good evening, everybody. Thank you all so much.
Bye-bye.
All right. Good night. Take care. Be well.